Hi guys, I'm Dr. Raman Tanwar. I'm an andrologist, and today we are doing 10 questions with an andrologist for you guys. I hope you get to learn a lot from this video.
So, my first question to you is who is an andrologist?
So typically an andrologist is a urologist, and which means that that doctor has a degree in urology. It may be an MCH degree in India or a DNB degree in India, but in other countries they can be different degrees. And then that person has done some sort of a fellowship, which means that there's some extra training that urologist has done, and or he dedicates most of his time or a majority part of his time in the practice of andrology. So that kind of a doctor who is a urologist and who sees mainly andrological patients is the one whom we can call an andrologist.
Okay, and how the andrologist different from sexologist?
So basically, as we've discussed, that an andrologist has to be urologist first, right? That's the system as far as India is concerned. But in case we talk about a sexologist, so there is no particular degree of a sexologist in our country. So anybody who has an interest in sexual diseases and their treatment, it can be a layman, it can be a a person who is practicing alternate system of medicine, or it can be just about anybody who, if has an interest, can write a sexologist in general to just guide the patient that they know something about it. But again, they are not scientifically trained to deal with it. Only as a part of their curriculum, they may be having a knowledge about these things, or sometimes there could be even people who don't have any degrees or knowledge around it. So a sexologist is more like a bracket term for anybody who's trying to practice diseases around sexual medicine or their therapies.
Okay. And what are some of the most common conditions that an andrologist sees?
So, as an andrologist, one of the important things that I see is male infertility because, as we know, a lot of couples today are, trying to conceive and they're trying to have a baby. And as we already know, the sperm counts they are declining, and fertility rates in general are declining because of the busy life and, a lot of other reasons, stress, and the choices that we're making every day. So, for the women, we have a gynecologist who sees those ladies who have problems with having an egg or having problems with the fertility. But for the men, the men are referred to us, to andrologists, to have a look at why their sperms are not healthy enough to be able to conceive. And then we find out various problems that, like varicocele, like infections, and many other small things which we then diagnose and we correct them, and then we are able to give a baby to the child. The other things that we see are sexual problems around men. So we know that erectile dysfunction is one of the biggest things that almost sexual problems affect one in two men, right? So every other person would have had some sort of sexual problem sometime, but they've not been able to come out with it. They're living with it. So all those things, sexual problems like erectile dysfunction, premature ejaculation, low libido where you don't have the desire to have sex, or if you have pain during intercourse, or even small things like the foreskin issues, frenulum issues, these kind of things are seen by the andrologist as such. Sometimes there are bending of the penises, plaques in the penises, so things like that. Anything which has to do with the genital system of the men, that is what the andrologist will look at.
Okay. And what are the most common myths men come to you with?
So I think one of the biggest myths that men come to us with is about masturbation, right? Because uh, somehow they've got to know through the internet or through the friends and family, or maybe if they've been to somebody who doesn't know the science properly, and they would tell that you masturbated too much and that has caused a weakness in the body. And typically then men would relate it, they will have a guilt, right? And that guilt would perpetuate the disease. It will increase the severity of the disease. So many men would come to us with sexual problems saying that they masturbate too much. Actually, they end up having some of the other hormonal issues, or they have issues around infections and things like that. So some people may have uh, again myths around them being shorter or weaker because of all these things. So I think the biggest myth is around masturbation. It's considered a wrong thing somehow, uh, and that has really perpetuated another realm of diseases which don't really exist in reality.
Okay, so my next question is similar to this only. Does masturbation affect the size of the penis?
I think this is a funny thing to think of, but uh, if you use something more, then ideally the size should increase. But we don't have any scientific study that says that masturbation will increase or decrease the size of the penis. So definitely, it's a big a myth, I would say, and it's good that we are trying to deal with this today in this episode.
And does excessive masturbation lead to shortening of the height or weakness?
Right. So usually, when you're in a college, and or when you're in those classes, like when you're just about to go to college, you have a time when you have a lot of questions around these things, and friends would often not know about it, as they would know as little as you would, and then they would just misguide, or they may just want to make fun around it. So I don't know how this legend is going on, that this will cause a reduction in the height, or your beard won't come, your mustache won't come if you masturbate too much, or you'll become weak, or you'll have sexual problems. So I think this is very early in the childhood of men. This kind of a thought is impregnated that this is a wrong thing, and it will cause damage to the body. I'm not saying that you should overdo it, but at the same time, there should not be a stigma around it, because that stigma kind of leads to a lot of problems that I am seeing daily in my OPDs.
Okay. And if you feel that you have an andrological problem, what should you do?
So I think very obviously, if you have a problem, for example, if you have a problem as a lady, then you will go to a gynecologist. So similarly, if you have a problem with your man parts or anything around sexual health or intimate health or fitness in general, you should be going to an andrologist. That's the ideal thing to be done. But I am also wanting to add what you should not be doing, right? At least you shouldn't be asking friends about it who know nothing about it, or at least you shouldn't be going to somebody who is unqualified, because typically everyone wants to make a livelihood, and you might find people who would then exploit the situation and say that, oh, you masturbate too much, oh, you've done that, this, and they would charge you heavy amount of money for medicines or therapies, which you may not need. So I think the best thing to do is to see a qualified expert. Another small thing that people do is that they would try to read about it on the internet, or see content around it, and then they would stuff up their mind with a lot of things, and again they'll see all sort of specialists when they actually look at these contents. And again, that leads to perpetuating a cycle of misinformation. So I think definitely you should see an expert, and even if you want to read about it, use some credible sources, which are actually health websites, or maybe you can go to medical literature and search there. But again, the simplest thing would be to find a good andrologist and see him.
And why is it important to take care of andrological issues in time?
Right. So that's a very good question, in fact. So what happens is sometimes you kind of neglect a disease, thinking that it's an andrological thing. Where do I go? Whom do I tell about it? Now you have to understand that all your andrological parts also, they are parts of the body only. That's not that they are somebody else's things, or they are separate from the rest of the body. They get the same blood, and they respond to your stress and everything. So first and foremost, you have to understand that any andrological condition is actually a beginning of a systemic response. Right? It's a reflection of what is going on in your body. So just like if you would have a pain in your chest, you will go immediately, and worry about a heart attack. You should also be concerned about the sexual problem, because these are, like, for example, it's not just an ED problem, it's a penile attack, so it requires attention. They may be showing that something is going wrong in the body. For example, even literature, if you look at the data, we've seen that if you have erection problems, then there's a likelihood that in the next 5-10 years you can have a heart attack, or you can be suffering from stroke, or even mental illnesses or diabetes. So there's a good correlation between sexual problems and systemic illnesses. The second thing why you should see early an andrologist is because these things also build up in the mind. So I have so many young people who've wasted their youth thinking about that, what will happen when they get married, or what will happen when they have a partner, and they're not able to focus on their studies, on their career. They're missing out on so many things in life, and we could have had so many more scientists, and but the youth is getting wasted thinking about these things. So better is to nip it in the bud. Once you have an indication that something's wrong with me, go and see an andrologist.
Yeah. Well, my last question to you is it okay to see an andrologist even if you don't have an andrological
Perfectly,
problem?
yes. Because if we talk about women, if they have a period, then that's completely normal, but they still will want to see a gynecologist, right? Just to have an understanding around it, to establish a relationship with the clinical side. So even for men, there are no particular avenues for men. That's the sad part, because we don't get periods, we don't have to go through childbirth. So men are often not able to see doctors because they don't need to, right? But there are many avenues, like a premarital time when you're about to get married. That's a time when you can see an andrologist just like that for a premarital checkup, which means that They will just ask you a few questions, do a few tests, and that will ensure that you are fit to have a baby tomorrow. Your partner, whom you're committing yourself to, you're giving the best to the other side. So I think that's something which has to be encouraged in today's society, to actually see an urologist just like that, just to be used to seeing a doctor or going to the clinic, just as a sort of token of being aware about your health. So you can go through regular checkups, and we have a list of those checkups available on the Men's Health Society of India's website, where you can kind of look at it, and you can see an andrologist and get your checkups done, so that we prevent disorders in the future. So very, very true. It can definitely, and definitely should be done.
Okay. So thank you, Dr. Raman, for being for giving your time to us, and definitely we'll come back with more questions to you.
Most welcome. Most welcome.